just kind of wanted to throw that out there because this is a serious problem. And again, the difference between access, it's really access to care, in my opinion. Everybody should have equal access. Everybody should have that opportunity. But we can't expect that everybody's going to have the same outcome. It's just impossible. So I want to kick that all off. So thanks for letting me vent a little bit to start this out.
Oh, I appreciate it, actually. And thank you for the kind introduction. So on behalf of everyone, you're very kind, Des. I can't help but to touch on something that you said. It's in terms of racism, or is it something else? And recently there's been a discussion, and a big discussion actually, institutional narcissism, and we've ran across that word. And when I read this, and I read the editorial about it that follows it, it was a little bit confusing for me. Physicians don't ever think of themselves as being narcissists when it comes to patients. But the bottom line is actually it's a subconscious behavior. You don't really do it because you want to do that. So this actually leads to sort of a culture that has been building for a long time. And since we've been frank and quite open, that is something is worth reading for anyone that is listening. So institutional narcissism is unique because it really kind of takes us to where there's just explained the differential outcomes in patients, because math or mathematics, statistics, well, mathematics itself doesn't lie. Statistics, there are some people that believe in it, and some people don't. They can say statistics can be altered, but math itself does not lie. So if we follow what you just said, and then we discuss it openly, and we would find that the current statistics that is available, that we discuss on podiums and we read about all the time, is really scary. If you just take everything we discuss and put it under one umbrella, under cardiovascular disease, and you would actually look at it and say, where is the worst outcome for cardiovascular disease in the US and then globally? What's interesting is actually the heart disease, as you know, is still the leading cause of death in the US. That's clear, still the case. But what's not interesting, and actually, in fact, a little bit scary, is this disproportionate, in terms of the effect of cardiovascular disease and Black people, African American. In the paper, the word Black patients, Black people were used. So the effect is actually disproportionate. And then you look at the rest of the study, and you look at the provider pattern, which was described in the studies. They were looking at, okay, can we study the provider patterns of care, which really interesting, because it showed, based on the statistics that were done, that there is actually a statistical bias toward procedures performed for a white patient versus Black patients from the get-go. I mean, that was found from the get-go. And in the beginning of this manuscript, they found this statistical bias. So now how do you get out of that when you find the umbrella, which is cardiovascular disease, have a significant statistical bias favoring white patients versus Black patients? Well, which explains the higher prevalence of the rate of cardiovascular conditions in Black people in America. And these conditions, we undermine them, Des and Dr. Cook, and let's see, hypertension, we undermined it. Just heart failure itself, we undermined it. Stroke, pulmonary edema. But if I give you the numbers that actually affect these patients, you'll be just shocked. But let me take you just one step closer to the reality of cardiovascular disease. The worse yet, to be a little bit shocked when you're reading this in terms of statistical bias, is the prevalence of PCI utilization among patients who are white versus patients who are Black. the number is so significant that that something has to be done, and done yesterday, because this is 2000. This study was done in 2020, published 2021. So this is the umbrella, okay? So all of these, I mean, if you put them together, the one disappointing fact, and this is a fact, okay? Death rate remains highest for Black patients, no matter what. Although they present to the hospital with the same condition as a white patient, but the death rate is still the highest among Black patients. So despite the fact that cardiovascular disease is higher in white patients, right? There's a 30% higher rate of death in Black patients. So, you know, you can't really take that and say, well, that could be statistical bias or wrong. This is actually a fact. So just with that, I'm gonna say, before I stop here, to show that there's a disease that has higher prevalence among white patients, but yet the mortality rate among Black patients is significantly higher, by almost 30% higher. So that alone maybe will give us a chance to talk about it a little bit more. And this is the latest recent study that was published.
Thank you so much for joining us for this discussion today. If you would like to learn more about our guests, head on over to our Patreon page, where you can access exclusive content, including the full segment of our show. Never want to miss an Inside the Doctor's Lounge clip? Be sure to click the subscribe button to our MD Coach's YouTube channel. As always, we appreciate suggestions for future show topics. Let us know what you're thinking in the comments below. And finally, special thanks to Ryan Jones, who created and performs our theme music for the show.